I'm Crystal. I'm almost going to be 50 and I don't have any health insurance. So this is my experience on how I got health insurance for myself without working for a company. Because all my life I have worked for a company and have always been provided health insurance. But this is the first time when I'm nearly 50 that I don't have a full-time job now because I got let go at my job last year. And so now I have to get my own health insurance, and I put it off for a while because I just didn't want to deal with it. And I didn't want to pay that money because it's a lot of money you have to pay for health insurance when you're on your own. Before I get into my story about that, just want to let you know that this is my experience. I'm not a health insurance expert, and every state differs on what their health insurance policy is. I live in Florida, so things are going to be different, for other states. But I do hope this video helps out somebody who's seeking health insurance for the first time on their own too. So let's talk about health insurance. I got let go at my job last year, my full-time job, and they did offer COBRA, and it was super expensive. It was going to be $800 a month if I wanted to continue my health insurance with what I had before. And I was like, I don't want to pay $800. So my handyman actually recommended that I talk to his healthcare, I believe it was concierge was his title. So I did call him up and explain my situation of what was happening. And he suggested that I do not get health insurance until the following year. The reason being is because since I was getting a severance from my job after I got let go, it would still count as my income for that year. And I guess you can get lower prices for healthcare depending on how much you make. So the less you make, the less you'll pay in health insurance, apparently. So I think he was talking about the Obamacare, ACA, Affordable Care Act. I believe they base it on your income. So he asked me if I go to the doctor a lot, and I said, no, not really. I mean, I go, for routine checkups and stuff, but I usually don't, go see the doctor all the time. I'm pretty healthy. So he was like, okay, so if you do have to go to the doctor, I would just pay out of pocket, do the self-pay rate. And you'll probably still save money because in the long run, if I were to pay $800 a month, that kind of equals out to about $10,000 a year. So most likely I would pay less than that for the year. And he also mentioned something about, if I get in a car accident, then my car insurance would pay for that. And if I got injured near a retail store, he said retail insurance would cover things like that. So he convinced me that, I don't need health insurance until the following year. So I didn't have health insurance that whole time. And I would just self-pay for any doctor visits I had. So I did have a gynecologist appointment. That was about over $300 for just a simple consultation, actually. I was just worried that I wasn't getting my period anymore. So that talk, and actually I got my blood drawn and urine sample too, just in case. I just wanted to make sure there was nothing wrong with me. So I think all that cost about $400 in the end. There was another appointment I had to go to where I had to get my eyes checked. So I have high eye pressure for whatever reason. So I have to go to the Eye Care Institute to get my eyes checked every 6 months. And that also cost about $350. So doctor visits were around $350 every time I went. But again, I don't go all the time. So I only paid that, I think at most 3 times within that year. So I did save money. So it was going okay without health insurance, but in the back of my mind, I kept on thinking, well, I should probably still get health insurance just in case something really bad happens to me. And plus, all these little things were happening to me with my body. In Japan, I had an incident where I got food poisoning and I saw blood in the toilet. So my mom and my sister were naturally concerned for me, so they took me to the ER. So I'll tell you about that story a little bit later. There's been some other things where a few weeks ago, I threw out my back and it hurt so bad. It was so painful. And I was starting to get scared that it would never fix itself. I mean, it did, thank goodness. So yeah, all these like little health problems were happening to me. So it just, again, in the back of my mind, I was like, I should probably get health insurance. And then one day I went to go see my hairstylist and we were discussing health insurance. And she was like, well, you should talk to my health insurance broker. She's the one who helped me get health insurance. So I was like, okay, yeah, I'll talk to her. Again, I didn't even know that there were healthcare or health insurance concierges or brokers. I just thought that you go on the government site, the Affordable Care Act, the Obamacare, and input your information, and that's how you got health insurance. But apparently there's like this huge marketplace for health insurance, and there's all these brokers and salesmen, and they are the ones that give you the best option for health insurance, and they make commissions off of that. So yeah, that was like a whole new, learning for me. So I reached out to the health insurance broker and she was very nice. And we were texting back and forth about my information, what I was looking for in healthcare. And she sent me a bunch of brochures. I think she sent me like 6 at once. And it was just so overwhelming. And there was like no explanation. She was just like, hey, just look over these brochures and let me know what you think and we can discuss. It's like, okay. So I didn't want to read each brochure, so what I did was I fed it to ChatGPT and asked it to analyze it and let me know what they thought was the best insurance plan for me, given my preferences on what I wanted for health insurance. And at first, when I fed all these 6 brochures, it kind of got confused. I think it was information overload, even for ChatGPT. So I started feeding it like one by one, analyzing each brochure. And I finally understood, like, okay, yeah, this one is not good, this one maybe. And so I ranked it 1, 2, 3. So what I wanted was a PPO, not HMO. So HMO is when it's like a very strict system where I can't really go see any doctor I want. I have to go to my primary care physician first and have them recommend any specialist that I need to see. Whereas a PPO is a much larger network and I can pretty much see any doctor that I choose to. And what I was looking for was basically, an accident-prone health insurance. I didn't mind if the deductible was pretty high because, again, I'm just looking for a catastrophic event happening and that's what I need health insurance for. So I did tell ChatGPT what was important to me or what I usually do when it comes to my healthcare. So I do go see a gynecologist once a year. I have to go get my mammogram once a year because several years ago, actually, not several years ago, 10 years ago when I turned 40, I got my first mammogram and they said that I had like really dense breast tissue. So they were concerned that it was cancerous. So I got 2 biopsies and they found nothing, but they were still super concerned. So they have me go every year for a mammogram just to make sure that I don't have breast cancer. I also have to go see an ophthalmologist because I have high eye pressure. So I have to get a prescription of eye drops and put that in my eyes every night. And if I don't, then my pressure will go up again. So I have to constantly put that in my eyes and also get my eyes checked every 6 months just to make sure my pressure is still down. So 2 visits a year there. And then other than that, I go see my ENT doctor maybe every 2 years because I do have allergies, really bad allergies, and I get sinus infections sometimes. So I do have to go see the ENT every once in a while. So, I don't really go to the doctor too often. I'm pretty healthy, I would say. So I just wanted the health insurance for catastrophic prevention. So ChatGPT narrowed it down to 3 plans. 2 of them were from LifeX, and then the third one was UnitedHealthcare Tri-Term. At first, LifeX looked like the better option. But once I talked to the health insurance broker, she was leaning more towards the UnitedHealthcare because it has a larger network and it was a more popular option. She was saying like most of her clients go for that health insurance plan. And then after I started looking into it, I understood why, because their doctor network is much, much larger than the LifeX. Because on LifeX, I was looking for my doctors that I go to, and none of them were in the network. Whereas United, my gynecologist was in there, and my ENT doc was also in there, and also my optometrist. So those were three. Ophthalmologist was not in there, but I was okay with that because I was considering switching doctors for that anyway. So yeah, in the end, I was like, okay, I do want to go with UnitedHealthcare. She was like, okay, well, what do you want to get your monthly payment down to? And I've been seeing like these monthly premiums, and the cheapest one that I saw from the brochures was $700. She did look up Obamacare for me too, and that was going to be $1,260 a month. That's insane to me. I just couldn't believe how expensive that was. I was like, no, there's no way I can afford $1,260 a month. So after like looking through all those brochures, I knew I had to pick some kind of reasonable number. So I was like around $500. So she was like, okay, we can get you down to $500. Because I did tell her I didn't mind the deductible being high. And so it turned out that she was able to get me to $500 a month. But there are lots of caveats to this plan. First of all, my deductible is $10,000. Like, I know that's insane, but again, these are for like, health insurance is just for emergencies. So I was okay with that. Another thing, let me go through this list here. If I have a pre-existing condition, I cannot get covered for that for 1 year. So I have to wait 1 year before insurance can cover anything like my eye pressure problem. Another thing was I have to wait 6 months to get covered for preventative care. That is so hard to say. I have to wait 6 months to get preventative care. Oh, I said it there. I only get 4 office visits a year that's covered. So I was like, okay, that's probably going to work out because I only usually go to the doctor 4 times at most in a year anyway. And then another thing too is that after 3 years, I have to reapply for this plan again. So yeah, lots of little things, lots of little rules with this plan, but it was the best one for me in my situation and what I wanted, and my premium was $500. I also got vision insurance included in this, so that's within the $500 is vision insurance because I do have to go to the optometrist once a year too to get my eyes checked for contacts and glasses. My eyesight changes a lot within a year. After I turned 40, my eyesight was just so bad. I'm nearsighted, so I need glasses to see far away. But the older I got, I couldn't see my computer monitor too well. So I had to get a separate pair of glasses for that, just for my computer monitor, and another pair of glasses to see far away. And then I can't wear any glasses when I'm looking at my iPhone. So it's like my eyesight is just all over the place. I'm not sure if all of you are like that, and that's near my age. But yeah, it's pretty frustrating. But yeah, so my optometrist was within this plan, so I was very happy about that. So the health insurance broker also added healthcare, what was it called? Accident ProGuard. So with this plan, I have the base plan, but then you can have add-ons. So the accident one was one of the add-ons where, if I get in a major accident, it covers for that, various things like surgery or hospitalization. And then the other add-on was the vision insurance. Okay, now so going back to Japan. Earlier this year, I was visiting Japan, and I go once a year to visit my family. And I got really bad food poisoning. And usually, I wouldn't go see a doctor for that, but I saw blood in the toilet, so my mom and sister were concerned. I was like, no, you should go see a doctor. But I had to go to the ER because it was after hours. It was a holiday weekend, so it was like the worst time I could go. But they were able to see me, and they did so many different exams and gave me a CT scan, a thorough evaluation, IV fluids. And with all that, because I was there for maybe about 3 hours. I'm a foreigner. My mom's Japanese, but I don't have health insurance there. So, considered a foreigner with no health insurance. And I had to pay double the regular cost because it was an emergency in the ER on a Saturday. So I was like, oh, goodness, this is just going to be so expensive. But it was under $700 for all that. Correction, the actual cost was approximately $545 US. Also forgot to mention that I'm totally fine and my diagnosis was ischemic colitis, which was an inflammation of the large intestine. And I was like shocked at how fair of a price that was, because if this was to happen to me in the United States, that would have been thousands and thousands of dollars. I wish the United States would have a better healthcare system. It's just crazy that we have to pay insane amount of money for health insurance. It's just crazy. But it is what it is. I live in the US, so I have to do this. I have to get my health insurance. So $500 a month now that I have to leave aside for health insurance. Sucks. Like, I don't want to pay that much money for health insurance, but I just have to cover myself, just in case something bad happens. So it is what it is. So yeah, if you're self-employed, freelancing, don't have health insurance and considering getting health insurance, I hope some of this information helps you out somehow. If you have your own health insurance, let me know in the comments below what you ended up doing. I'm just very, very curious on what everybody has, because I have a lot of friends who don't have a full-time job and work for themselves, and they don't have health insurance. They just don't believe in it. Yeah, I don't like to get health insurance. I don't want to pay money for it, but I just feel like I need to get it just in case something bad happens to me. So yeah, I'm just curious what everybody else is doing. Like, do you get your own health insurance? Did you get the ACA? Or did you go to a marketplace? Or did you look for it on your own? Or did you go to a broker? Because yeah, this whole experience was very interesting to me. I had no idea that I had to look for health insurance in that way, and go to a salesperson for it. All right, well, thanks for watching as always. I appreciate all the comments and views and subscribers. It's been amazing to hear from all of you, and I want to continue to hear from everybody. So thanks.